Accelerate is one that is looking at sourcing innovations in sexual reproductive health and gender-based violence. We started with stakeholder engagement and also trying to meet different partners who would be of help in supporting the program. We have carried out info sessions in 5 districts so far and reached out to over 600 people, an average of 120 participants per district, basically trying to introduce the challenge areas. Most importantly, we are looking at both refugees and non-refugees. So the districts we are looking at include Arua, Yumbe, Moyo, Ajumani, Amuru, Agago, Lamour, and Kitgum. So if it's a refugee hosting district, we prefer to visit a refugee settlement to go and interact with these people, let them know about what we are doing. Your team should have both refugees and non-refugees. The teams that are selected are given seed funding.
It's going to create like job opportunity among the people who are in the area like us.
So it means we are training the youth so that when they go out, they stand on their own rather than looking for jobs.
The solution should take a new approach to a problem or use an existing approach in a new way.
We have domestic violence, which is caused by many things.
Facilities are not enough for people, like women, like during time for delivery.
Rape, early marriages, which are always giving them also make their lives at least miserable.
From the focus group discussions that we had in the 8 target districts, the young people and women identified several challenges that they face within their communities. From this, we came up with several challenge areas, but we are going to focus on 3 which seem to be most pressing to the community members. 1, we're looking at access to timely, context-appropriate, and accurate information and education on sexual, reproductive health, and gender-based violence. 2, we're looking at access to essential sexual reproductive health services and supplies for women and young people affected by conflict and their host communities. And 3, we are looking at alcohol and substance abuse among young people affected by conflict and their host communities.
So, drinking of too much alcohol can also bring gender-based violence.
Because this program will help through by educating those youth. As being I myself, I'm now educated through this program.
Probably we think that they may not have enough access to information to reproductive related issues.
We need to look at innovative ways of reaching young people with information in places or settings where they will not be constrained to access them.
So any innovation that we can think of in relation to the technology that is going to be a big move to have an impact in relation to addressing this area of reproductive health.
Excitement that we have had from the district leaders, they feel that we could actually support more people because they are overwhelmed by a number of challenges in the areas of sexual reproductive health and gender-based violence.
Adolescent girls drop out as a result of providing the minimum basic reproductive health materials, things like sanitary pads.
Almost every term, 4 to 5 of our girls drop out of school as a result of teenage pregnancy and, as I said, sexual abuse and all that.
Our cultures promoting early marriages, and especially amongst the refugees, where teenage pregnancies and marriages are culturally acceptable.
And the program as well is targeting to look for a local solution, a local service provider. The capacity is built, and this person, being also well versed with the environment, can actually have an easy access to our young girls.
has been a great journey, and we're receiving a lot of excitement. We believe that with the time, we can have several other interventions that support the other innovators who may not be part of this program.